Hi, good morning Chadwick. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 12th of February 2022. How are you doing?
Hi, good morning, Mihiraa. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Chadwick Glover.
And what is your candidate number, please?
My candidate number is 213175883.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How will you encourage patients to proactively manage their health and improve their habits?
When I encounter an individual whose health is in decline, or may be affected in the future by her or his current health choices, I always take the time to explain the relationship between our nutritional and lifestyle choices and overall health. I then describe the more detailed effects of certain habits, such as the potential to develop mouth and gum issues and lung diseases because of smoking or tobacco use.
How do you interact positively with support staff?
I understand that the support staff, such as care assistants and administrative professionals, provide essential care to patients and deserve to be treated with respect as members of the health team. I make sure to get to know the individuals on the support team so that I can encourage them to provide the best care possible and also to pay attention to their expertise and the information they get from their interactions with patients.
What's the best superfood?
Sorry, there isn't one. Forget the latest news on, supposedly, magical treats like blueberries, chocolate, emu meat, or red wine. Researchers often get amazing results by isolating a substance in the food and then injecting it into cells in a petri dish, or administering amounts to rats that far exceed what you could really get in your diet. Yes, these foods are healthy, but only as part of an overall sound diet.
What should diabetics do during pandemic?
Diabetics also fall under the vulnerable population, so they should practice social distancing during pandemic. However, since follow-ups with a doctor are crucial in their case, they should try and resort to telemedicine, which is basically a video conferencing facility that many hospitals are offering now.
Is it okay to cleanse your body by fasting from time to time?
As long as you are in good health, a brief liquid fasts or cleanse is fine. But don't expect wonders other than a sense of personal accomplishment. Perhaps any physiologist will tell you that properly functioning lungs, liver, kidneys, and intestines do a fantastic job of keeping your body free of impurities without the help of fasting. If you do pursue a fast, always make sure to drink enough fluids to avoid dehydration.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you need clarification on, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning. I am Chadwick Glover, one of the nurses working in this clinic. Please let me know your name for the records.
Hi, good morning, my name is Mihiraa.
May I know what makes you come here to the clinic?
Nurse, I'm here because my daughter insisted I have a Boostrix vaccination. So, I would like to know about the vaccination.
All right, may I know the reason why she insists on taking a Boostrix vaccination?
Yes, she is pregnant and encouraging me to get the vaccine, as she has heard that some illnesses can be fatal for infants.
All right, I understand her concern. May I know your age, please?
Sure, I'm 55 years old.
Are you on any medications?
No, nurse.
That's great. First of all, Mihiraa, I'll tell you why the Boostrix vaccine is for.
Yes, I would like to know about it.
Okay. Mihiraa, Boostrix vaccine is a combination of 3 vaccines used to prevent diphtheria, tetanus, and whooping cough. Like any other vaccine, Boostrix vaccine stimulates the immune system to act against microorganisms to prevent such infections.
All right, nurse. Actually, my daughter is ever anxious, and that's why she is insisting on me. I really don't need this vaccination.
She might be ever anxious, Mihiraa. However, the Boostrix vaccination will be a very good decision as a preventive measure.
I don't really think so. You know, nurse, from my childhood onwards, I prefer not to have unnecessary medications and injections. Especially injections like these, which acts for 3 dangerous diseases, as you said.
I can understand not only your thoughts, Mihiraa, but also your daughter's concerns as well.
What sense does it make, nurse?
I know that something is bothering you. Just let it out. I am listening, Mihiraa.
Nurse, why should a healthy and hygienic person like me have to take this vaccination?
Kindly be patient to listen to my words, Mihiraa. I can clarify your daughter's concern to you.
All right, you may please go ahead.
In the first 6 months of life, babies are at high risk for complications from whooping cough, even if they are healthy. This is because their immune systems are still developing.
Okay.
In fact, babies younger than 2 months of age only have the antibodies they get from their mothers to help protect them. Therefore, it is important to receive vaccination in order to prevent those infections and their spread to the child.
All right. I understand that.
You should acknowledge that whooping cough can cause serious, relentless coughing, limited blood flow, brain damage by oxygen deprivation, and sometimes life-threatening complications in babies.
I understand what you are saying, nurse. But another thing is I'm out in public very often, and also do not catch diseases easily. So, I don't think I'm at any risk of diphtheria or tetanus.
Definitely, I agree with you, Mihiraa. The risks of diphtheria and tetanus are low. But the vaccine is a 3-in-1 injection.
Oh, God. No, please.
Just relax, Mihiraa. This is a preventive vaccination. And it won't affect you adversely in any way.
All right.
Mihiraa, just consider this vaccination as a grandma's care and safety for your grandchild.
Yes, nurse. You are right.
I'm glad to hear that, Mihiraa. Anyway, Mihiraa, I think you need some time to accept it. I suggest you return next week for the vaccine.
Thank you for your understanding. I'll return next week to have the Boostrix vaccine to protect my daughter's bab from whooping cough, diphtheria, and tetanus.
That's great, Mihiraa. See you next week.
Thank you, nurse. That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.